All right, so this is the rest of chapter 10. So we left off with a discussion of attention deficit hyperactivity disorder, or ADHD. So ADHD is characterized by two sets of symptoms. So first, there is the symptom of inattention. So inattention, inability to focus, inability to show sustained attention. So that would be paying attention to the same thing for long periods of time, inability to selectively filter, so selective attention. So can I focus on the relevant information and ignore distractions? So that's one aspect. The other aspect or symptom of ADHD is hyperactive and impulsive behaviors. So hyperactivity, higher than typical levels of energy. So kids who have this, they're in constant motion. They move, go, 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 go all the time. It's like they never stop. They never seem to get tired. And then, of course, the impulsive piece here is inability to control behavior. So doing things without thinking. So for adolescents, then, they can have what we refer to as a combined type, which would be symptoms of both inattention and hyperactive and impulsive behaviors. They could also have the predominantly inattentive type, where the symptoms of inattention are only present. And then they could also have the predominantly hyperactive and impulsive type. So we do see that there are some gender differences here. So predominantly inattentive is more likely to be diagnosed in girls compared to in boys. Predominantly hyperactive, impulsive, and combined types more likely to be diagnosed in boys than in girls. Oftentimes, we do not see diagnosis of ADHD until the child has started school. And that makes sense if you think about the demands of school that require attention, right? They require ability to stay still and focused and control your own behavior. So typically, we don't see much demand for those things before school starts. And so that's why we don't see the diagnosis until school. The other thing to note here also that's interesting is that because of those gender differences, girls are much less likely to actually be diagnosed at all, because they are more likely to show those symptoms of inattention, which means that they're oftentimes not a behavior problem in the classroom. Whereas for boys, if they're showing the symptoms of hyperactivity and impulsive behaviors, well, yeah, they're a real challenge for teachers in the classroom. And so they're much more likely to be seen as a problem, and then much more likely to get the diagnosis, and then of course get the help that goes along with that. But if you're inattentive, well, you might just be daydreaming, right? Or kind of looking out the window, but oftentimes you're not causing a behavioral disruption in the classroom. So girls oftentimes are overlooked. All right, so let's talk about our current understanding, some of the challenges in adolescence and then also into adulthood. So we used to think that if you had ADHD as a child, you outgrew the symptoms. We now know that that is in fact not the case. ADHD is considered a neurodevelopmental disorder. So neurodevelopmental means that it is connected to the nervous system, in particular the brain, and development, how the brain grows and changes. And so we know that the brains of children who have ADHD are qualitatively different than the brains of children who do not. So you don't really outgrow ADHD. You oftentimes just figure out ways to manage it. And so if you know someone who's an adult who has ADHD, they might tell you some of those ways that they actually manage it. So in childhood and adolescence, then we typically see that children who have ADHD oftentimes have lower grades, and that makes sense if you can't stay focused, right, on your material. Behavior problems, which we already talked about. They are also much more likely to be placed in special education, and it could be that it's coupled with a learning disorder. Sometimes that happens, but oftentimes it's more that they can't stay focused long enough to be able to learn the material, and perhaps that part of it is overlooked, and so we assume that there's something else going on. In early adulthood, then, ADHD is actually a predictor of likelihood of substance use disorders. So think drugs and alcohol. And that makes sense if we think about a limited impulse control. Well, of course, yeah, using drugs would be one example of inability to control that particular impulse. As we move into adulthood, though, the symptoms still typically continue. So now we do recognize that adults can still show those symptoms of inattentive. As an adult, this could manifest as maybe I forget to do a particular project for work or something like that. I miss a deadline to pay a bill or something of that nature. Deficits in executive functioning. So remember, executive functionings are those particular things that are related to my ability to reflect on my memory, my ability to kind of keep multiple pieces of information in mind as I'm trying to solve a problem. So those kinds of things are definitely affected here. For men, we see higher risk of car accidents, and that's probably not overly surprising if you think about the impulse control issues, and also inattentiveness. Problems in relationships, so impulse control and inattentiveness, right, come into play here. So that could become perhaps irritating to a partner. And then also higher likelihood of engaging in deviant or antisocial behaviors. Again, typically a function of those hyperactive and impulsive types of behaviors. All right, so when we look at the brain then, so this image that you see over here compares the brain of a typically functioning adult with the brain of an ADHD adult. So the red here indicates areas of underactivity. This is your nose, in case you couldn't tell. So this is an area that is essentially underactive. So this would be the frontal lobes, right? The stuff that's kind of right up here in the front. So we see extreme underactivity in the frontal lobes of the brain, which, you guessed it, seat of executive functioning, planning, judgment, decision-making, impulse control, behavioral control, all of those things that are directly connected to the symptoms of ADHD. So we do know that there is something connected to the way that the brain develops. So abnormal brain development, which can be the result of exposure to birth issues, complications during birthing, exposure to other potential toxins or teratogens in the environment. We also know that this seems to run in families. So that tells us that there is likely some degree of genetic component involved here as well. And then we also know that the way that the brain organizes and develops is, of course, shaped by the social environment, so shaped by what's going on around you. And so if you have a family environment that is also chaotic, well, then that can potentially support development of the brain in this particular way. So it's a complex issue in terms of our understanding of kind of what causes ADHD, but we do think of it primarily as dysfunction within the brain. All right, so how do we treat it? So we've got all different types of things that can happen here. One of the most common ways to treat ADHD is through the use of stimulant medication. So stimulants, this perhaps sounds maybe a little bit counterintuitive, like why would we give kids stimulants who are already hyperactive? So stimulants like Ritalin, for example, they work specifically on the neurotransmitter dopamine. And if you remember learning about dopamine, that's a little pun there because dopamine is involved in learned behavior. Yes, so learned behavior, it's involved in reward. So essentially what happens, these medications, they stimulate that release of dopamine in the brain, which then essentially allows the person to be able to focus, to be able to kind of control their behavior. Antidepressants may also be given. So oftentimes children who have ADHD, they feel very demoralized. They don't understand why they're always getting in trouble, or they don't understand why they can't seem to master the academic skills that their peers are. And so oftentimes they don't really feel very good about themselves. They don't like school. And so antidepressants might be medications that are given to try to treat some of those symptoms. We also, though, see the use of therapy, so psychoeducation, which is essentially teaching you or educating you on what ADHD is, what it looks like. But you may also do individual therapy where you work with a counselor, work with a social worker, a psychologist on trying to treat some of the symptoms, but also potentially on managing the behaviors. So for example, if I know that I have the inattentive subtype of ADHD, well, then I might work with a therapist directly on how do I make sure that I keep track of all of my assignments that are coming up. So very deliberately keeping a calendar, for example. This over here that you see here, this is something related to behavior therapy that you might see if you're working with children, even in an elementary school or middle school classroom. But it's basically a behavior chart. So behavioral therapy works quite well with kids and adolescents who have ADHD. So you can see here that for every single class, there is a kind of set of goals here. Did you stay seated? Did you stay on task? And did you follow directions? So looking at your progress here can help kind of give you an idea of how you're doing, right, in terms of meeting those goals. All right, and then lastly here, we're going to look at the public policy and how educational issues are connected here. So we talked a little bit in class about IDEA, which is the Individuals with Disabilities in Education Act. So that was passed in 1990. And so according to IDEA, we as a country, so here in the United States, broadly are mandated to provide services for children with disabilities of all kinds, including evaluation of the disability, eligibility determination, and then also appropriate education, including what's called an individualized education plan. So that's here. We typically refer to these as an IEP, and I'll show you an example of what that looks like. But it's basically a plan that is specifically tailored for a particular student to directly target that student's disability. So it's individualized for that particular student. Teachers are supposed to follow it, basically anyone who works with the child in the school system. The other thing that IDEA mandates is that we need to provide educational services for children and adolescents in what's called the least restrictive environment. So in a setting that is as much as possible as similar to settings where children who do not have disabilities are educated. So whenever possible, we want to engage in this practice of what we call inclusion, which is educating children who have some kind of special needs with full-time regular education children also. So including them as much as possible in the typical educational experience. So this is an IEP planning form. This is just a sample for you, but it can give you an idea about what some of the objectives might be for a particular student. So this one, for example, might be for a student who has ADHD. So social skills, right? Part of it, yes, decision making, staying on task, group activities, and interacting behavior. So you can see that the day is divided up here, right, into all of the classes that this adolescent is in, and then giving specific guidance for what to do. So at lunchtime, to improve your decision making, we are going to give you some decisions, right? So you get to decide the order in which you eat your food so that you can have some practice there with decision making. All right, so let's talk then about adolescents who are gifted. So this is our kind of other end of the spectrum here. So we've talked about learning disabilities. Now we're going to look at adolescents who have an extremely high IQ, so considered to be gifted. So when we talk about intelligence, we usually talk about IQ, which is that intelligence quotient. So remember that that is one number that is supposed to symbolize your kind of overall or global level of intelligence. So when we look at IQ scores, this might take you back, cause some PTSD for you if you hated statistics. So this is the normal curve or the normal distribution, a bell curve This represents the distribution or the variation of intelligence quotients, right, or intelligence testing scores within the entire population. So the basic idea here is that 100 is the mean, that's the average, right? So that's the average IQ score that we see in the general population. As scores move away from 100, either above 100 or below 100, scores become less and less likely. Okay, so 100 is the average. As we move away from 100, either above or below, scores become less and less likely. So when we're classifying adolescents as gifted, we are going to go 2 standard deviations above the mean to 130. Okay, so look, only about 2% of the population has an IQ score of at least 130 up to 145, and only 0.1% of the population has an IQ score of above 145. So statistically speaking, very rare, right? Rare segment of the population. So when we talk about adolescents who are gifted, that they have that above average intelligence, and sometimes they also have what we would call talented, being kind of exceptionally talented in a particular domain. So this might be, someone who is a gifted artist or someone who is a very accomplished musician at a young age. For adolescents who are gifted, oftentimes there's maybe one particular area where they really excel. So, you might shine in mathematics, but perhaps your language skills aren't super great. So that would be an example of adolescents who are gifted. So when we talk about the things that characterize adolescents who are gifted, oftentimes they're precocious, meaning that their developmental level in kind of whatever area they're really gifted in is well beyond what we would expect to see given their age. They kind of make their own path, right? They kind of do their own thing, so kind of march to the beat of their own drum. And they often have some kind of serious passion. So something that they really, really care about, something that they really, really enjoy. When I was a graduate student at University of Maryland, we had a whole program there for adolescents who had graduated from high school early, wanted to work on their bachelor's degree early. So in some of my intro psych classes, I had 12-year-olds. Yes, they're like sixth graders in my classes. And they did a great job. They were sometimes better than much older students. They typically had the younger gifted students take classes as cohorts, so as groups, so that they would have some kind of social structure to rely on. Because as you can probably imagine, a 12-year-old's maturity level is very different compared to an 18 or 19-year-old college student's maturity level. So although adolescents might be intellectually gifted, their cognitive skills are advanced, their social skills are oftentimes not, or their emotional skills are oftentimes not. So they might still be kind of not on track with their peers in that particular way. All right, stay tuned for chapter 11.